All right. Hello.
Hello.
Welcome to the space program. I'm Marla Love, and this is your invitation to slow down, settle in, and create a little more space. So today I'm having a conversation with Erica Trivet. She is a wonderful osteopathic practitioner and many other things. Beyond that, Erica, I'm going to pass it to you to
Oh, yeah.
introduce yourself.
Yeah, those many other things. Yeah, I'm also, so I used to be a dancer like yourself, which is why we get along so well. One of the reasons.
Yeah.
And aside from having studied osteopathy and practicing in Vancouver here, I also am a Feldenkrais practitioner, another obscure thing that nobody knows what it is. And as well, now
I
also
love
like
it.
to add to my arsenal, yeah, Eldoa teacher, which again, another one that we like to talk about. So yeah, I'm interested in the body and also making space in the body and making space for discussions like this. I'm really excited to talk to you.
Yes, me too. Yeah, I stumbled upon this idea of space as a theme that appeared in so many of the things that I've studied. And along the way, space in our breath and what that means for our overall health, it has become like foundational. And if I think about breath, the star of the show is
The
the
respiratory diaphragm.
That's right. The respiratory diaphragm, the breathing diaphragm. I like to call it sometimes the central pump.
Mm.
We tend to think of the heart as our main pump, but I'd like to describe it as the central pump because it's like centered in our torso ish. And it's one of our strongest muscles in our body. For women, it's the uterus, and the tongue is pretty strong too. But tell me a little. I'd like to hear your description of like what's your relationship with the
Oh
respiratory
yeah.
diaphragm?
Well, lately I've been in the pursuit of understanding more embryology and especially development and the movement. That's sort of sometimes when I think about like, why am I studying this? This is so weird. Like little embryo, when I think about like little embryo.
Yeah, yeah, yeah.
Yeah, so itty bitty. Yeah, it's more the movement and the relationship and the changing relationships and the actual movements and gestures that our body go through that make up our human form. And the diaphragm is so central and so huge. It is really beautiful to have a better understanding. I do remember even in my studies, like curious student goes up to teacher in a course, it was a heart course, and I asked the teacher something about the heart or the diaphragm, and they said something like, oh, it's really complicated, it's made up of four different parts, and that was the extent of the answer, which I was like, oh shoot, I wish she would have just dropped everything, whipped up the, taken out the color pens if it was in her arsenal, and explain more. But that's okay. As time goes by, we realize there are things that we would really like to explore more, and maybe understanding that complexity can be helpful.
I'm
Doesn't
I'm
need.
guessing you just put a pin in that and then did that later.
Yeah, but so what I really love is so you said this word central, and there is a part of the diaphragm, the central tendon or the phrenic center as it's called. It's more fibrous and it's really this central aspect of this dome-like structure. And it is more fibrous, hence the name, central tendon. And yeah, in embryology, it has another name. Everything always changes names. That's why it's hard to study anatomy in these parts, because in 1 second it might be called one thing and another thing it's called something else. But
Oh, as if it's not confusing enough.
yeah, so septum transversum is the real transverse septum. So yeah, it's a structure that's ends up being more horizontal and perpendicular to other structures. And that is maybe why it is so important.
Mm.
Um, so I can describe the movement. One of the movements that it does really in when things are really beginning to change in embryology, you have the primitive and the sort of central nervous system and spine developing and all the vessels and your face is kind of like head planting the primitive, yeah, the primitive heart. And there
Right.
comes a point, a pivotal point in the development where that folding is sort of, if you will, being anchored by a certain structures that don't grow as fast. So the things are growing around it.
Mm.
Um, and these relationships start being less important. And so what actually happens is a sort of like peeling away, or the head pulling away from its relative to position to the heart center. And what happens is, so if this was the spine and this is the septum transversum, is there's this peeling away from this structure, a horizontalization and a flattening that
Oh,
occurs. So
wow.
this action, actually peeling away from that structure, creates a negative vacuum in the emerging space here, right, like right where my eye is.
Yeah, yeah.
And that is creating then more space for the heart, and actually creating the negative pressure for the lung development as well. And the neck, the cervical spine, because we don't actually have a neck, it begins to emerge because this space begins to change between the heart and the head, pulling apart. So it is so central in human development, and then begins to create this negative vacuum in the space, and all these other structures
The way
begin to.
you're doing that and describing that, it sounds to me almost like you've got like a version of a flower bud, and like
Yeah,
it's like a flower petal, like an aspect, like a sliver of the flower opening. And
for
I can
sure.
imagine like from the inside how that when it starts like this, how that creates a vacuum, and the fact that
Yeah.
our lungs, a lot of people don't know that our lungs function as
Mhm.
a vacuum. Like we don't have to, that's why we can breathe unconsciously.
Yeah. And even in osteopathy, we talk about the heart in some spheres as being not necessarily like a pump, but more like a big sucker.
Ah, wow.
And I like the analogy of a flower for sure, but it's you don't even really have you don't have many as much fibers when you're developing, even though the septum transversum, or that primitive diaphragm, is made of more fibers. We are mostly it's all fluid. It's just fluid
Right.
with different densities and different viscosities. So definitely thinking of like eddies and whirlpools would be, I think, more appropriate, or like beautiful, like when you take that dye and you throw it in the water, or different substances, and it creates different patterns and textures.
Wow.
We could get into like discussions about different kinds of fluid flow, which is not my expertise. That would be somebody else.
Yeah, no, that's okay.
But
I want to start to link it to, so I want to start to link that unique development to
yeah,
the stages of, obviously when we're in utero, we're not breathing with our lungs, right? We don't need to breathe yet. So it's
no,
not
no.
until we are born and then we're in the air, and then how does that get started? Like how does that
Uh,
kickstart?
with a slap on the back.
Yeah,
That's a really good question. I wish I had more answers for that. Like we just know, you
we
know.
just know it's instinctual.
Yeah, I mean, there's certainly, the coughing and getting the fluid out.
Hmm.
But I
I
would
do
think that's
remember
complex.
being
I might have to
pregnant.
come back to you about that one.
I do
Um,
remember being pregnant that it is in the final stages. I think the final month to 6 weeks that the lungs are like it's in the latest stages that the lungs are forming, and so that's why when you're even
yeah,
born just a little bit premature,
yeah,
there's a
super.
concern of the lungs.
Yeah, even I had a friend who had a very, very premature baby, and they weren't allowed to fly for a very long time, even after he was out of the preemie ward, because of the pressure changes with flying. They were nervous about what that would do to his
Mm,
delicate body, for sure. And that gesture of peeling away is something, those gestures, why I like to understand the embryology, is because those gestures continue. They're the essence. There's a saying that I think it might even be Einstein, something about essence. The essence remains, but the form has changed, or something. I'll have to
mm,
look it up. But the essence of those patterns and what happens are still there, even if the form looks different.
mm. Wow. Yeah, that kind of makes me think of the, rings of a tree, like
Absolutely.
where the origin
Mhm.
no longer obsolete. The outside form has changed, but you wouldn't have the outer changes if you didn't have that, and the origin remains. That's kind of cool.
Yeah, and
Um,
timing and cascade of events is everything in development. Yeah, things can go weird and
I
sideways.
find it so fascinating when you learn about the myriad of things that go on in development. It's sometimes amazing to me that more things don't go wrong more
Oh
often.
yeah, I agree. Yeah. There's certainly when you understand the face, what happens with the face and the real changes there, it's like, oh.
Wow, that's staggering.
Yeah.
Well, let's get back to the diaphragm here and breathing. So in my, as we could go on, but in my exploration, from the movement perspective, my first study was really yoga, and I fell in love with pranayama, breathing practices, and the connection of the breath and the nervous system. And my very first yoga teacher said, and I was just so thrilled. She was like, if you control your breath, you control the nervous system. So calm down your breath. She's like, you can't be angry and stressed if your breath is soft and slow. And I was like, wow, that's so amazing. Um,
Yeah.
and it was just the beginning of the study.
Yeah.
And so since I feel like I will never stop learning about breath and the diaphragm. Like I just feel like there's so much,
Yeah.
and I'm fascinated by the shape of the diaphragm, the fact that our lungs do expand in all directions, yet our stress levels can restrict the diaphragm and lung movement. And
Yeah.
that's an idea that's in some minds might be obvious, in other minds it's kind of, or if I look at it more from the osteopathic perspective or of like how the body forms and how the body works, it's like, how does that happen? How does, like, my understanding is that when we're stressed, afraid, we get like this tunnel vision, and
Hmm.
our body kind of takes on that shape, even our vision takes on that shape. We get very like, and when
Hmm.
we're relaxed, we take in peripheral space. We kind of have the whole panorama. We can take in the horizon, and that softens our diaphragm's ability to move in all of its directions.
Yeah, absolutely.
So
And
cool.
it's lucky for, I think, everyone. I do feel like the importance of breath is being emphasized in a lot of different ways and contexts and environments, from like people understanding a little bit more about the vagus nerve and autoregulation and how the breath could really help calm you, that centering. Yeah, even like James Nestor's book, of course, comes to mind. That's been on,
Absolutely.
it should be on everybody's reading list if it's not already. Uh,
Yes.
just to understand that you do have control. For me, also, it's not just about that, but like if you're not breathing nicely and well, you could be reducing circulatory pathways and communication in certain areas,
Hmm.
and that can be really detrimental to the health over a long time.
Hmm. What
Yeah.
would you say is the most common issue with breath, or perhaps even the most common misconception or misunderstanding around good breathing?
Oh my gosh. It's a good question. Well, I see all kinds of breathing patterns, as I'm sure you do as a Buteyko breathing teacher.
I do.
Um, I think just I like to emphasize how important it is. Like when I start to explain a little bit of the anatomy or like what can happen or how you can play, because there's so many ways you could play with the breath.
Absolutely.
I think they start to understand a little bit more about how it can be a tool and used, and to take the time is not a waste of time.
Mhm.
Mm, and yeah, of course, if you're in pain, it's harder to breathe. So there's that sort of like catch 22. Uh,
Uh,
well, the continuity through the structure. So the diaphragm, like we know what the pillars of the diaphragm, but maybe a lot of people have no idea what the heck the diaphragm has pillars. What are those? Uh,
yeah, tell me about the pillars.
yeah, so those are like places where the connective tissue in the back of your body continues. It actually continues and connects to the spine and to some ligamentous structures in the front part of the spine. So
Mhm.
and it's different from right to left. on the right side. It goes down. And granted, this is all continuous connective tissue. There's no real start
Course.
and end point for people
Yeah.
listening. I understand that, but I think it's important to remind you, yes, your head and toe are connected. So
Yeah, that's such a good point.
um, but they do have more obvious, thicker, fibrous filaments, if you will, like on different levels of the lumbar spine. So on the right, it goes down to L3, the third lumbar, and the second it's L2, so it's a little higher up. And then they continue up or down, whichever way we're going. But they wrap around in an area also around the aorta. So it's like yeah, your aorta goes through that, and so does your vena cava, your big vein, and then your esophagus. So there are structures that go through it, and other structures, other nerves are related to your digestive system that go through it as well. So it's really important maybe to understand that maybe some of your digestive problems might be related to the fact that you're not very breathing very well.
Right.
And because it's a more of a transfer structure as well, you have structures going through it. It's like could be a real place of importance to investigate, to explore yourself if you can't see a practitioner or don't have the funds to. It certainly is cheap to sit down and just focus or lie down on and focus on your breath.
Yeah, I mean, that's where I think yoga can be a lovely playground for that. A nice, gentle, old school hatha yoga class where you're just doing some fairly basic general postures.
Oh,
And
yeah.
the purpose is just explore your breath in this posture. What structures can you move? Can you move your ribs? Because the diaphragm is kind of central deep inside the body, it can be more challenging to sense or feel or have an experience of. Um,
Mm,
it's I try to help people start off in your imagination, like let's get a roadmap in our mind. Where does it attaches all the way around the bottom ribs, it domes up towards your heart. I sometimes describe it as like a toque or a skull cap over the lower organs,
hmm.
and then above we have the lungs and the heart, and
Yeah,
so
that are attached to it.
that are attached to it exactly. And I don't know what's wrong with my brain, but but I feel like recently I got to take a class with a wonderful Eldoa teacher in Toronto, Petra. She does a practitioner class, and we were actually looking at the liver, but she was showing some images, some anatomy images of the heart, and I was just like, wait a second, because it showed the pericardium, which is sort of the fascial casing of the heart, kind of like
Yeah, the
stretched out and
coronary ligament.
attached to the diaphragm. And like in my mind, I was picturing like all these little shapes in here, in here,
Mhm.
and that as if the diaphragm like moved away from the heart and there'd be some kind of a gap, and
Yeah.
then it just reach out. But then since I had that image now, which is kind of a new image for my brain, I'm like, so you mean when the diaphragm descends on an inhale, it's kind of pulling the heart with it?
Yes. Yeah.
So cool. And the lungs. Yes. Ah, it's just,
Yeah, I know it's
that's
wild,
so
which is
cool.
connected, also has the heart has connections, very direct connections even to the bottom cervical vertebrae. So
C6, C7.
yeah. So sometimes like in my world, people will come in and say their neck hurts and what I end up working on is actually not very much neck stuff. But
Right. It
yeah,
could be
so
that there's tension at the level of
it
the.
could be the diaphragm for sure, and some restrictions in the diaphragm, a strain in the diaphragm, a strain throughout a whole complex of connective tissue that would then pull on a cervical vertebrae enough to fire off some pain signals. Yeah,
Mhm.
yeah.
Yeah, I feel like I like to think of the breathing diaphragm or the respiratory diaphragm and the heart are kind of like dance partners.
Mm,
And so if your diaphragm is stuck and you're just breathing upper chest breathing, stress breathing, your heart is working so much harder. Like it doesn't have its partner.
that's right.
It's if we can get that central pump moving, then your heart is like, oh, now we're doing this
Yeah,
together. It's
for
so much
sure.
easier.
Absolutely. Yeah, that becomes more obvious. I was remembering this as I was thinking about this conversation we were going to have. Um, I think you can find it on YouTube somewhere, a video of like somebody, they did like a imaging can't remember what kind of imaging was of somebody before surgery and then after like open chest surgery, and the number of layers they had to cut through to do their procedure. But what you was really obvious in the imaging was how that relationship was disrupted, that the dynamics of the diaphragm and the pericardium were really hampered after the operation, and how that sort of dance, if you will, was no longer happening. So I've heard some people like talk a little bit like a slingshot. It's an action that is happening in a concert. And when you cut through tissue for, yeah, life-saving purposes, yes.
Yes, yeah, yeah. If you need it, you
And
need it.
you're disrupting that. So it is an important movement. And even I've worked with post-operative patients in yeah, after they've healed their scars and working on the malleability of the bone and working on the ligaments of the heart. Seeing those changes are really important. And
Mm.
even just working on the breath would be important and helpful. Yeah.
Yeah, I have worked with post-op patients as well, probably much further along than you. Usually they have to come, by the time they come to me, they've been okayed by their
Yes.
doctors for movement, which
Yes.
which is
Always.
for me usually six, six
Yeah.
weeks, 6 weeks to 3 months, generally six
Yeah.
weeks.
Yeah, for
And
sure.
they're not in a rush because those tissues have to heal. So, but I find that interesting. That's an important distinction because I have worked with concussion patients before that are not okayed for exercise, and it was a real learning experience with me for me. Thankfully, I had my senior teacher who was also piggybacking with me to help guide me because it made me realize, even though I've been teaching for 30 plus years, I have always seen people that were okayed for exercise. So
Hmm.
even when I'm being very, very gentle, there's a very different level of gentle when that person hasn't yet been okayed for exercise. So
Yeah.
when if you've had to have surgery there and those tissues need to mend, I guess there's going to be some scar tissue there. But have you found those tissues will mend and they'll get that slingshot
They'll gain
action again?
they'll gain resilience for sure. And just like with I like that you're talking about, yeah, the being careful. The breath and the diaphragm are very strong, and there can be instances where working on your breath with an over, let's say, enthusiastic approach can be very
Detrimental.
harmful. Yeah, I think of a few instances where some people have really like actually died, but fortunately rare, and maybe there were underlying conditions, and but it's important to warm it up just like you would any other part of your body before exerting it or pushing it in a particular way. So having some sort of sense and know how to listen, but starting simply is good, and beginning to sense like where the initial threshold of resistance comes from, how you feel that in your body. I think that can be very safe
Mhm.
and gratifying, and
Yeah.
just knowing that I think you learn this with age automatically. And I don't think it's something to get frustrated over either, is that it's just about like taking your timing and being a little bit more strategic in the approach that we take to our bodies and discovering new things that can be
Mhm.
really beneficial for our health and well-being. And um, but that like, yeah, you don't have to do it all in one day. You don't have,
Yes. Well, it
it's
brings
more
the
time.
gentleness is a really good reminder that one of my biggest frustrations and of misconceptions that I see about breathing is that more is better. And
Yeah,
so there's this idea that, oh, you just need to take a deep breath. And so then the person is like,
right.
which is kind of a forceful, almost like a showy. They're not trying to be showy, but it's like I'm showing my breath what to do. Whereas I
Yeah.
try to instruct people that your relationship with your breathing, and as you're guiding it, once you learn the direction you'd like it to go, you want to guide it gently, almost like you would a very young child.
Yeah.
Just very gentle encouragement of like, okay, good, you did that. Because the moment we try to, it's like a yin strength. that feminine yin energy that is soft yet powerful. Because as you're saying, there are some extreme stories where something is, you can push things in a direction that is really unhealthy, and so it can be deceptive. um, in my earlier years of just having learned Buteyko breathing, I was all excited because I thought, well, if they could just get to this point, then they're going to
Mm,
start to feel so much better. And I would be like, okay, so just do this. And as people, most of us are quite compliant and we want to do a good job. So I
mm,
noticed as I would ask questions later to the client, I'd be like, how was that for you? And they're like, that was really hard and I really couldn't do it. And I was like, oh no, it
right.
looked all calm. They looked relaxed, but they were just trying to do a good job. And I was
Yeah.
like, okay, back up, back up, back up, back up. That's not productive.
Yeah, it's funny. It makes me think of this. We were being asked to breathe in concert, like in a certain rhythm in one context, and it wasn't like hurried or anything. It was actually kind of slow, and I realized like actually this feels really uncomfortable for me to try to breathe at that rhythm. I was like, I need to ignore you and
Yeah.
just take my time because otherwise I feel like I'm trying to like it just felt really restricting.
Or
Um,
performative somehow. Like
I'm
and
following
having both of us been
along.
performers, like that's one of the things I found trying to get to authentic healing through authentic breathing. You have to strip away the performer. You have to strip away the compliant student and the person who you just wants to do well. You have to really peel back the layers to be just really calm and gentle. And so that's why for me, I try to use that shortcut of like you're working with your inner child and
Hmm.
or I would even say just I don't always say inner child. I'll say like just imagine a child that you love. I mean, we love most little children, but you would never say to them, "Oh no, no purple trees. Trees are brown. Trees are brown and the leaves are green." And they're like, and you'd be like, that's so pretty. I love how you made pink leaves on your tree. Are those flowers? They're like, no, they're leaves. And you're like, okay, okay.
Yeah.
And so with ourselves too, like in order to get to that authentic place where your breath is actually nurturing, healing, and then you're able to start to guide it in that pathway to be one of our most powerful tools for self-healing is
Hmm.
that gentleness. And that part can be hard to teach for type A personalities or people who are really feeling like they need to heal. Like I need, okay, what's the fastest way? Well, how am I
Yeah.
going to get there?
What do you, yeah, I am always trying to understand how to create, how to encourage that space for and time, space and time for allowing yourself to explore. A lot of people just seem like that is a huge obstacle. There may be some limiting belief in the way. Um, like we have this inherent curiosity, I would say, the two of us. Certainly, yeah, as dancers, I think there is that sort of innate in the industry to be curious and always striving and exploring and learning and opening ourselves to new experiences so we can
Mhm.
improve ourselves. But like a lot of people, I find just won't make that space or time. And it can be a very vulnerable place too. So there's that too, what might emerge. I don't know if there are words of wisdom that you can think of. I'm always just trying to create some sort of like, why don't you just explore a little bit in the morning, a little bit at night?
Yeah, yeah, I have my little tips and tricks. I've thought about this for many, 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 many years. How do I help people create the space, in myself included? I have the same kinds of challenges. I have two kids. I have a busy life. I have many aspects to my work that need attending to, my home, my
Yeah.
fridge, my everything. So when we're in our home, when you're in your home space, there tends to be no end of like, oh, I need, oh.
Yeah.
So
Certainly
somehow
as
we
a
need to
mother.
create we need to create a protected space.
So do
So
you think it's about creating a space? Because I've been thinking about that too. I'm um, like I've made that space in my home where I definitely do those things, and I'm changing my routine or my
mhm,
my way so that I am more encouraged to do and to play and to continue exploring and take care. Because also, as you age, it comes to taking care of. And it's yeah, like people will say, "Oh, my coffee table," or this, and I'm like, "Well, just move the coffee table, like rearrange your
Right.
whole house. Can't you rearrange your
That's
whole
so true. We live in Vancouver where everyone's like, I don't have space. There's
Yeah.
no place,
So
we both teach Eldoa. So you're like, you need a wall. There's no wall. We'll close the door and put a little thing on the other side that lets people that you live with know that I've got my legs against the wall. Don't come crashing in.
no entry.
So I've had to be creative. I will often tell people, just before you spring out of bed in the morning, just close your eyes and take some of those soft, slow, gentle breaths. Or at night, as you're getting ready to go to sleep, like bookending the day that way. There is always that moment before you get out of bed, and there's that moment as you're going to sleep. The other places I suggest to people is when you find yourself in the washroom, in the bathroom, you're taking a bio break. You might even just pop in there to wash your hands, or whatever you're doing in there. Give yourself an extra 2 minutes or 10 slow breaths or 8 slow breaths rather than rushing in, rushing out, rushing here, rushing there. So another word for that is like habit stacking.
Hmm.
So maybe you like to take a bath at the end of the night. Maybe so you can be like, oh, while I'm in my bath, I'm going to like bump this experience up a little bit with 10 soft breaths. Some people like to set a timer because you can relax your mind when you know you have protected that time. Maybe it's 5 minutes, maybe it's 10 minutes.
Hmm.
That's another way. And then I have one other tip that I like to give people, especially if they have kids or a busy family or a busy home, for any reason. And if you're driving home, taking the bus home, whatever, stop, get off, or stop your car or get off the bus a block before your house and stop. Sit in your car or sit in a park just for 5 minutes, 10 minutes. And again, you could set your timer, but give yourself that buffer, because once you walk through that door, for many people, and it's not
Yeah.
always the case, but for if you have a busy home for any reason, give yourself that buffer. And it doesn't have to be a secret. You can tell your partner, you can tell your spouse, you can even tell your family and say, hey, look, I want to be more present when I get home, and I want to do my check in with my nervous system beforehand. So
That's helpful.
yeah, I think so, because there's something about that central pump and the breathing and all of the myriad of things connected to it, from digestion, mental state, mental health. I mean, there's a reason I call this podcast the space program, because when there's no space in your breath, there tends to be no space in your mind.
Mhm.
And I love how you were describing creating a space in your home. If you're able, if you actually can create a beautiful, welcoming space. Maybe it is a matter of just moving a coffee table and putting something on the floor, putting AirPods in or headphones on, and having, I suggest ambient music for airports, by Brian Eno, is just that perfect spacious music for soft breathing. And then you don't have to follow the music with your breath. It's just providing that atmosphere for you.
Yeah, nice.
Well, yeah, so we both end up telling our clients to practice breathing at home, hey?
Maybe some people listening will also
Yeah, yeah.
take
So
the invitation. I hope so.
I want to encourage anyone listening as well to reach out to Erica. I'm going to put the information in the notes, or reach out to me for a little more help. Or but be cautious, be informed. I think that all breathing guidance is not equal. Just in general, relaxed breathing is softer, slower, quieter. So
Mhm.
when people say deep breath, I ask you that you think deep in your lungs, meaning close to the diaphragm. Deep does not mean it has to be this massive breath, but
Exactly.
yeah, so we want to keep the structures available. So sometimes some stronger breathing just to create that internal massage can be beneficial when this area tends to be feeling a little stuck or numb.
Oh,
Uh,
yeah.
but then
We
once we've opened that up, we want to just allow. We're not pushing, we're not forcing.
Yeah. Yeah, we're gonna have more discussions about this later, I know.
We are. It goes so well
I'm
with,
holding back. I'm like, yeah, we're just gonna let it sit there because I could
yeah,
talk about
I think
that forever.
it goes so well with my idea of the osteopathic practice in a way, because I think of your practice as very yin. You can tell me if I'm wrong. I think of it as so gentle yet powerful.
Hmm.
It's not done with force. And so I feel like the approach to breathing, when done well, should be quite similar. It's like
Yeah.
be
Yeah.
curious, listening hands. I feel like osteopathic practitioners have the best listening hands in the entire world.
Yeah, they talk about that a lot.
Mhm.
That's
Well, thank
true.
you so much for being
Oh,
here, Erica. This is
thanks for having
new
me.
for me. But until next time, our mission is simple: the pursuit of space. And today we specifically brought some awareness to having a little more space in our breath and highlighting that powerful muscle, that central pump, the respiratory diaphragm.
Yay.
Yay.